Okay. Hi, everyone. If you're nearby, just hop back on and we will be getting started with the stress relief and music therapy session. So thank you all so much for coming. And let me just make sure everything is good. Okay. So we're going to be starting. So hi, everyone. My name is Misha, if you just joined in, and I'm going to be presenting a little bit about stress relief and just ways to get involved with that. And then we have the amazing Ranjani Sukumaran, who is a board certified music therapist, and she will also be giving a presentation and will be leading us through a music assisted relaxation as well. So let's go ahead and get started. So what is stress? Just really generic. It's just a feeling of emotional or physical tension in response to a challenge or demand. So why is it so important to relieve stress? In short bursts, stress can actually be positive, such as to meet a deadline or to help you avoid danger, and that's known as acute stress. But if stress is continuous, it's known as chronic stress, and that can cause a lot of health problems, as you can see there. And obviously, I'm not trying to stress you guys out with these health problems, but it's important to be aware and just know how important it is to relieve your stress. So some just generic ways to relieve your stress include practicing mindful breathing through mindfulness, meditation, yoga, and just finding your own personal calm. And then going outside and interacting with nature, getting some vitamin D. Getting enough sleep is also really, really important. And exercising, eating healthy, staying hydrated, and also just creating things help relieve your stress as well through painting, baking, and focusing your mind on creating something or just any form of like any sort of hobbies. So at my school, I started a club called Crafting for Charities, and we are focused on relieving our members' stress one craft at a time. So some crafts that we've donated a total of 565 crafts to various charities since 2018. And some crafts that we've created include cards for hospitalized kids, braided dog toys for animal shelters, and more, as you can see listed there. And most recently, we made thank you cards and face masks for hospitals. So you can see pictures right there. We collaborated with a couple clubs at Cal High to do that as well. I'm also part of the Agape Bell Choir, where we ring music for senior nursing homes. So this is my kind of link to music therapy, because whenever we go and ring, there is such a difference in the audience members. All the senior citizens are always so calm and they love seeing our performances. And actually my bell choir instructor is here today as well, Ms. Settle. So if you are interested in joining, you should definitely contact her. We aren't practicing right now, but it's definitely a great way to get involved with just a great volunteering opportunity as well. So now we're gonna go and get into the music therapy section. So Ranjani Sukumaran, the board certified musical therapist, will go ahead and get started.
Hi, everyone. Thank you so much, Misha, for that nice introduction on stress relief. And I imagine you're doing a great job in the conference so far. Thank you for the opportunity to speak on music therapy today, and hello to everyone. My name is Ranjani Sukumaran. I'm a board-certified music therapist, and today's presentation will be on music therapy and evidence-based therapy. The definition of music therapy is it's the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional who has completed an approved music therapy program. Music therapy is a health profession that was established in the 1940s in America, but it also dates back to prehistoric times with music for healing such as the lute, the harp, and the sitar. Music therapy addresses physical, emotional, cognitive, and social needs of individuals. After assessing the strengths and needs of each client, the qualified music therapist provides the indicated treatment. Through musical involvement in the therapeutic context, clients' abilities are strengthened and transferred to other areas of their lives. A little bit about me. I grew up singing Indian classical music, Carnatic music, for around 13 years. And I also studied some Hindustani vocal music and sitar during my UC Berkeley years in undergrad, and studied a little bit of Western classical technique and opera, and then had the opportunity to shadow some music therapists, including one who's attending today. Hi, Joanne. And that was a wonderful opportunity that set me up for graduate school in music therapy, which took around 3 to 4 years. And I did around 2,000 hours of clinical work, 5 practicums, a 6-month internship with senior and rehabilitation and geriatric mental health, and a 1-month post-internship in hospice and palliative care. And then I wrote my thesis towards the end of my master's on music therapy interventions for end-of-life care. I currently have around 4 to 5 years of experience with seniors, hospice, children, and more. And I started a private practice called Healing and Wellness Music Therapy. Lastly, since shelter in place began in mid-March, I wanted to share some music with the community. So I began a YouTube channel that whenever you get a chance, I'd love it if you could check it out. So what are the benefits of music therapy? Music therapy reduces stress levels, it regulates breathing, it improves mood, it improves attention span and memory, it increases dopamine and serotonin, and more. It reduces blood pressure, helps with fine and gross motor skills, improves cognitive skills, improves emotional regulation and expression, improves creativity, self-esteem, and motivation. What are some populations that benefit from music therapy? Infants, toddlers, children, teenagers, young adults, seniors, a whole range of populations benefit from this field, with varying diagnoses from medical illnesses to mental illnesses to special needs and comorbid illnesses. Definitely families and caregivers who are grieving or coping with the loss of their loved one also benefit from music therapy. And then there's just typically functioning people, members of the community who are looking for overall mind-body wellness and stress relief, and they also benefit from music therapy. And actually, since shelter in place began, I started online community music therapy groups once a month for our local community, just for stress relief and improving mood. And if you're interested in that, please do reach out to me. I'd love to have you in the group. Music therapists work with doctors, social workers, nurses, speech therapists, occupational therapists, and physical therapists. So it's a very collaborative approach to best meet the needs of the patient or client. What are some potential music therapy goals? Well, it helps to improve mood, reduce depression, reduce anxiety, improve social skills like turn-taking and interrupting less, improving communication like expressive and receptive communication, improving cognitive skills like attention span, memory, and multitasking. It improves motor and fine motor, gross motor and fine motor skills. It helps to improve quality of life, and it can also improve self-esteem. What are some music therapy interventions? Well, definitely singing is one of them, especially a familiar song. When you think of a patient with dementia, singing a familiar song helps to trigger a memory in them, and oftentimes they can recall lyrics and sing along, even if they're completely or mostly nonverbal. So that's the power of music and singing. Also, playing and exploring on instruments, songwriting, improvising vocally or instrumentally, listening to preferred music and discussing your response to the songs, analyzing lyrics to songs, substituting or personalizing the lyrics to songs to meet your own story or share your own personal walk through life, music-assisted relaxations, which I'll be doing one of those today for you guys, a music with imagery, and if we have time, I'll be doing that as well, music to movement, which is great for physical rehabilitation, and that's where they might co-facilitate with a PT. Verbal processing, like you would see in any counseling or therapy session. Sometimes clients or patients want to talk about their feelings, and so we use validation and good reflective listening skills to support them. And that's only if they're capable. The great thing about music therapy is also very beneficial for people who are nonverbal or can no longer express themselves through words. And then there's also music with art and poetry, and these are just some of the interventions. So now I'm going to talk about some of my progress with clients. So a current session that I'm doing is with a senior in India. She's a 73-year-old woman who was referred to me for chronic right arm pain because unfortunately she fell off her chair a year ago and has not had an opportunity to go to the hospital to address the situation, especially with COVID in the past few months. She is not going to the hospital. So she was referred to me to help redirect her from the pain and just give her an opportunity to express herself and lift her mood through our music therapy sessions. And she actually recently agreed to maybe recording one of our sessions. So if you keep in touch with me, I'd love to share that progress of her with you guys, because it's so wonderful how the music takes her mind off her pain and just brings her to so many smiles and laughter. And she expresses herself so jubilantly just seeing me. Even though it's online, it's such a beautiful relationship we've created over time. Next, I'd like to talk to you about the 3-year-old who I've been seeing recently, just 5 or 6 sessions. So he's on the spectrum, and his parents brought him to me saying ABA didn't work for him. We tried 7 months, and he's not able to communicate or express himself verbally. So since within 5 or 6 sessions, we had a breakthrough where he began saying the word happy 3 times. And his mom was so amazed and said he's never said that word before. So music therapy is very beneficial for communication skills, and it's moments like those that really touch my heart and make me so happy to be a music therapist. Next, I'd like to talk to you about an 8-year-old boy with special needs. When he first came to me maybe December 2019, he was really distracted and had difficulty following through with even one song or intervention, let alone all the songs or interventions. His impulse control was low. He would go bang on the piano before I gave him permission, and it didn't look like he was responding to the music. But I didn't want to give up on him because each child is special and unique in their own way and progresses in their own way. And after a couple of months, he had a breakthrough where he suddenly spontaneously was humming one of the songs that we do, I Can See Clearly Now. And since then, his attention span, in the past 2 months, his attention span, focus, and impulse control, and even maintaining a calm body has improved significantly. And I am going to be sharing a clip of him, a small clip, snippet of how he's responding to the song now and singing and taking turns with the music as well. So next, I'd like to talk to you about a memorable experience with a hospice patient with dementia and COPD. This was back in 2016 when I was working with Vitas Hospice Healthcare, and a nurse referred me to see him because he was experiencing loneliness. That was the main reason for referral. Even though he was living with his wife, the difficulty for him, within a facility, he was sharing a room with his wife, the difficulty for him was that she had a severe case of dementia and was nonverbal and couldn't even remember or recognize that that was her husband. So I was a strong support system for him, a source of solace and comfort, where he could talk about his feelings. He could reminisce on the good times with his wife and how much he loves and adores her, how he met her. And we even had opportunities to do family music therapy sessions with his daughter, granddaughter, and dog. He was very involved and active in terms of instrumental play, singing and improvising vocally, and actually said I was a light in his life towards the end of our time together. And I was with him towards his final days. So it was a very special bond, and again, very appreciative for that experience. Next, I'd like to talk to you about a 93-year-old woman. She's pretty high functioning, no dementia. I started seeing her before COVID, maybe 10 months ago, and we've been having weekly sessions, and it transitioned over to online or telehealth music therapy sessions since March. And she really loves to see me. Every time I come online, she's like, oh, I missed you. I'm so happy to see you. And she always shares experiences about her family. And what we often do are song dedications, which we record and send to her children. And then we also do some songwriting just to highlight her strengths and accomplishments as well. So she's really benefiting from music therapy too. Next, I'd like to talk to you about a 16-year-old teenager with some behaviors like aggression and bossing and controlling. Sometimes she'll scream or repeat the same thing at an elevated voice for 10 or 15 times just to get her way. So what I'm trying to do with her is establish boundaries and rules, but also give her freedom to explore musically. So that will help to reduce her anxiety in terms of wanting to control things. And hopefully this skill will transfer outside as well. And she is making progress. In our last session, she sat down and waited for me to prepare without screaming or demanding and said, ready? And her mom even sent a video clip of her saying, I miss Ranjani. So again, that bond is so special and beautiful, and I'm looking forward to see her continued progress. I have many more stories I'd love to share with you. If you'd like to hear them, please do reach out to me. I also wanted to mention the online community music therapy group for stress relief and possibly other topics. We'll see how it evolves. That's for young adults, adults, and seniors. Anyone who's interested in just experiencing music with a community and talking about their responses. And then now I'm going to play for you a clip of the 8-year-old boy who made so much progress within a couple months.
Let me know if you can't hear it. It won't start until a little bit into this clip, but let me know.
I can see clearly now. Rain has gone. I can see it in a way. Beautiful. Had me blind. He said we're bright, sunshiny day. Beautiful.
So the outcome is the client is now more musical, more attentive, his impulse control has improved sustained attention, improved memory, confidence, and definitely trusts me more. So I'm looking forward to his continued progress. Great, thanks for watching that clip and listening so far. Now I have a live music therapy intervention for you called the music assisted relaxation. I'm just going to raise the volume so you can hear me. I apologize if there's any technical difficulties, if the music goes in or out. Again, it's much better in person and much more effective in person, or even a one-on-one online session, it glitches a little bit less. So I apologize in advance, and I hope it's still comforting and relaxing for you. Okay, so first, before we get started, I'm going to ask you to observe your stress levels from 1 to 10 and make a note of that. Where are your stress levels today from 1 to 10? And find a comfortable position. You could be sitting or laying down, and let's get started. Take a nice deep breath in. And a deep breath out. Now let us create a ball of light by rubbing our hands together. Hold this ball of light in your hands. What color is this ball of light? Take this ball of light and place it on the area in your body that is experiencing the most stress and anxiety. Allow the ball of light to penetrate into that area and slowly release any tension or stress. Now gently close your eyes and breathe in. your mouth. And breathe in. And breathe out. Breathe in relaxation. Breathe out stress. Breathe in relaxation. Breathe out stress. Now create a ball of light again by rubbing your hands together and placing it in the center of your chest on your heart. Breathe in deeply, allowing this light to permeate and expand your heart and your compassion and acceptance for yourself and others. Now let the light spread outward and further outward from your heart, spreading to your chest, to your neck, to your stomach, to your arms and to your fingertips, through your legs and down your toes. Let that light spill downward from the crown of your head, down your eyes, nose, lips, throat, chest, heart, stomach, hips, thighs, knees, calves, feet, and all the way down to your toes. Breathe in, 3, 2, 1. Breathe out, 3, 2, 1. Breathe in, 3, 2, 1. Breathe out, 3, 2, 1. As you let the light spread everywhere. Breathe in relaxation and breathe out stress. And breathe in relaxation and breathe out stress. Now repeat after me. I am calm. I am peaceful. I am relaxed. I am serene. And now I'm going to give you a moment of silence with the music as you let those words soak in. Beautiful. Notice Notice your breath. Notice your body. Slowly now, and with the help of my voice, bring your awareness back to the present reality. Begin to move your fingers and toes. Feel your feet, your legs, your back, your arms, and your head slowly awaken. Notice how calm you feel. Slowly, in your own time, open your eyes. Thank you. So, how do you feel now? Where did you feel most relaxed in your body? And most importantly, what is your stress level now from 1 to 10? Please post in the chat box below if you're comfortable. We'd love to hear if your stress levels went down from this music-assisted relaxation. Wonderful. I'm loving the comments in the chat box. Thank you. All right. So now, thank you so much. I'm so glad everyone enjoyed it. And again, it would be even better in person. So let's move on to the next slide. Music with imagery for relaxation, or music with affirmations. These are two other interventions a music therapist might use for stress relief and mood improvement. So we're going to try to get to one of these two interventions after our question and answer today. Based on the poll that Misha sends out to you, you can choose whether you want Somewhere Over the Rainbow with a little bit of imagery, or if you want positive affirmations, music with positive affirmations. All right, we'll just minimize that and move on. So now, a little bit about healing and wellness music therapy, which is the private practice I started recently. I offer individual and group music therapy sessions, both online or at the studio in Fremont. And I do have experience doing home visits for hospice patients when I was working with Vitas and also Kindred Hospice. And I currently make some home visits in Fremont, but I highly suggest the studio. It's the most efficient for therapy and learning. I also follow COVID precautions, wiping down instruments, everyone wearing a mask. And if you're interested, please check out my website, hwmtherapy.com, for more information. And if you are interested in receiving a session or learning more, don't hesitate to contact me at hwmtherapy@gmail.com. Well, thank you everyone for your time and attention today. I sincerely appreciate it. And I sincerely appreciate Misha for inviting me to present at this healthcare conference and organizing such a beautiful conference. And I hope the intervention was comforting and soothing for you and you enjoyed learning about my clients, some of my clients' progress. I wish you all the best for your healing and wellness. And now let's open the chat room for questions.
Our session is going to be ending in 1 minute, but we do have a 15-minute break after this. So if you'd like to stay, you can stay for questions and just put them in the chat if you have any. And also, we will be doing a short music assisted with, you guys voted on music with imagery. So, yeah.
I have a question. Is it like, can I ask questions?
Yeah, sure.
Okay, cool. So I'm very, very interested in this. I love music. I'm currently going to be a junior at the University of Washington, and I'm getting my bachelor's degree in psychology. And I was just wondering, to take this path to become a music therapist like this, is higher education like necessary after getting your bachelor's degree, or do you need to get a master's? Is that absolutely necessary?
That's a good question. The minimum is an equivalency where you do a couple practicums and you have a minimum amount of hands-on experience. Maybe I think it's 1,500 or 2,000 hours of clinical experience. So if you just do a 2 to 3 year equivalency, which is basically equivalent to a bachelor's degree in music therapy, and then sit for the board exam, you should be set to go. I just did a master's because my undergrad was from UC Berkeley in music. So I wanted to apply that to the healthcare profession, and I got my master's in music therapy. But the reason why it took longer, around 3 to 4 years, is because I did the equivalency portion first, followed by the master's.
Oh, okay. How does the equivalency work? What's the process like, or what exactly is that?
So it's basically another bachelor's degree, but you don't get awarded a bachelor's. That's why it's called an equivalency.
Okay, got it. Thank you.
No problem. Good luck. Best of luck to you.
Thank you so much.
Someone asked in the chat, can we use an instrument that is a little louder, like a saxophone, for music therapy?
Of course. Generally, the instruments they train you on as part of your music therapy clinical training is with a piano and guitar. Those are our main accompaniment instruments, especially if you're traveling. Guitar is recommended, like for my traveling hospice job, or even when I work at the studio with other populations, I bring in a guitar. But there's already a piano there. A saxophone, trumpet, tuba, any other instrument is also wonderful if you have experience or background in that, if you want to make that part of your music therapy session. Let me take a look at some of the other questions. Let's see. What other music besides guitar do you use? I think I just answered that, Jennifer, but what do you think, Misha? Did I answer that question?
Yeah.
Okay. Thank you for that comment, Joanna Condon. I really appreciate that. Let's see the other questions. Oh, sorry, I realized I would prefer affirmations. Is music therapy useful for psychiatry? Definitely. So with a lot of the seniors that I work with, they have other like comorbid, meaning a second illness, a mental illness, and are often on medication, which only helps to a certain degree. The music acts as an extra support system for them. So it can be great for anxiety, depression, and other illnesses related to psychiatry. I hope that answers your question, Lauren. If you have further questions, you can reach out to me. I can share some of my case studies and experiences with mental health. Do you need to sing for music therapy, or can you use music from others? So sometimes I'll ask a patient or client to share a song that's personal or meaningful for them, and we'll listen to it and discuss their response or how they connect or relate to it. So it's not always me singing for them, but with patients who are lower functioning, who may be nonverbal or suffering from some sort of illness, whether it's dementia or cancer, oftentimes providing the support and singing is the most soothing, effective method. And let's see. Let me know when we have to wrap up questions, okay, Misha? Let's see. I think those are all the questions, right?
There's one that says, what are your favorite songs to use in therapy?
Oh, okay. What are my favorite songs to use in therapy? I think it depends on the population. So with children's populations, I often use children's songs, but sometimes I get creative with them and we improvise or write a song together based on what they're expressing and feeling. Sometimes I use like classics or standards, like I did for that 8-year-old. I used I Can See Clearly Now, which has such a positive message and is catchy. So it really depends. I try to individualize it for each client. And then for seniors, I definitely use songs way back from the 20s all the way to the 60s or 70s. And I see which one they light up or respond or sing along to or talk about the most. And that's how I individualize my interventions and songs accordingly.
Also, if anyone needs to leave for the break, they totally can, but we're just going to stay here for a couple more minutes to ask questions or answer the questions. So I see one that says, talk about your passion for music therapy more and how it developed. So how did you develop your?
Yeah, I'd love to answer that question. So somebody asked what my email address is too. It's H as in healing, W as in wellness, M as in music, hwmtherapy@gmail.com. And it's listed on the slides as well. So I have been passionate about music since I was a young girl. I was introduced to Indian classical music as a young, like 4 or 5-year-old, and I grew up singing Carnatic music. My grandpa was a musician, so he really also introduced me to music, even though he was in India and I was here in America. He's my grandpa on my mom's side, so I really honor and respect everything that he shared with me. And after that, I just went to UC Berkeley, and a lot of my friends and teachers were really supportive of my voice and my ability to improvise. So that made me passionate about pursuing a music degree. And then I wanted to learn how to apply it towards helping others. So I did some research, and actually an undergraduate advisor at Berkeley suggested music therapy. And combining that with research, I went through the application process, took all the prerequisites like psychology, guitar, and piano, and prepared for auditions, and then applied for my master's degree. So it's definitely been a journey, and my passion for music only continues to grow.
Great. There's another question. Let's see. What are some subjects that are preferred to take in high school and university for music therapy?
Great question. Maybe if you're in high school, if you're in your band or choir, that's great, or any like outside extracurricular music classes would be wonderful. You could also I took AP psychology in high school. That also gives you a brief intro or glimpse. You could even take a community college level course in psychology or music while you're in high school to get a taste of whether or not you're interested in the field. And then within undergrad, you can go straight from high school to undergrad, apply for a music therapy degree in your bachelor's itself. Although some people say they didn't have enough time with their bachelor's, like it wasn't a good enough, detailed enough experience. And I felt like my master's was very thorough. So there is a benefit to having a foundation in just music for your bachelor's and then doing that second level of music therapy for your master's. But it's up to each person. I hope that answers your question.
There's a pretty interesting question that says, do certain instruments induce certain emotions?
Wow, that's such a great question. Definitely, the voice is our most natural, raw instrument that induces a lot of catharsis and healing. It can bring people to tears just using their voice to express their feelings or hearing someone else's voice. And there are other instruments that evoke different feelings based on each person's preferences and culture and upbringing. For instance, someone who has been raised on Carnatic music might really appreciate the nadaswaram, which is an instrument to Carnatic music. Someone who's raised on Hindustani might really appreciate the sitar. Someone who is raised in European music might love listening to the guitar, and it might evoke instant calmness or instant peace in them. So it really depends on the culture and upbringing of each person.
Great. There's also, let's see. Do you have to be informed with all the new songs? Like, do you constantly change up your songs, I think, if new songs come out that you like, or?
That's a great question. For some of my young adults, I do try to learn the more current songs. Like I learned Girls Like Me for one of my younger clients. Or is it Girls Like Me by Adam Levine? I always say Girls Like You. I confuse the title. But I learned that one, and I learned Shake It Off. So you do have to be up to date based on your client age. But with the seniors, the standards will do. And I learned a lot of those standards while I was in grad school itself.
Cool. So it also says, does music have to be calming? For example, if a client has rock music as their favorite genre, does that affect how the session works?
Definitely, it doesn't have to be calming. For some people, especially who are depressed, you might want to do something a little bit more uplifting with a stronger beat to encourage them to participate and sing along. So it's not always going to be with the goal of calming, like I mentioned some of the goals in the previous slides. And there's also something called the ISO principle, where you match them where they're at. If they're really happy and excited, sometimes you might want to match it with a rock song, especially if that's their preference. And if one of the goals is to help them be more calm, then you would match them with a hyper song or a happy, like upbeat song with a faster rhythm on a rock and roll song, for example, and slowly bring it down, maybe even slow down the rhythm of that specific rock and roll song so it sounds more like a lullaby, and that could calm them.
Cool. And then, does health insurance cover music therapy?
That's a great question. It's music therapy is pretty new. It started it became established in the 1940s in America. So right now it's gaining credibility, and some insurances do work with music therapy. For instance, with the hospice company that I worked at, the first one and also the second one, I think they bill through Medicare. So I don't directly work with insurance, but the company doesn't charge the patient for my services because they have Medicare. So if that explains it. So yes, to a certain degree, but it's not like as prevalent as, let's say, a psychiatrist or a psychologist. And I recently did get one client who wants to go through music therapy and go through insurance for music therapy because her insurance covers music therapy. So I would work with her indirectly and write up a super bill for her and give it to her at the end of our sessions. And she would give that super bill to insurance to reimburse her. So I hope that answers your question, that yes, it's there, but not fully there. But people are working with insurance now. Music therapists are working with insurance.
Okay, so I don't see any more questions. Go ahead, and if you think I missed yours, you can type it in the chat. But that was amazing. I was so thankful for you, you to come, Ranjani. And I hope you all really liked this session. We didn't have as long of a break as I was expecting, but that's totally fine. I hope you all got your questions answered. And we will be starting with the nutrition and wellness session in two minutes. So you can hang tight till then. And yeah, thank you so much for coming.
Thank you, everyone. Thank you, Misha. So we're not doing the next intervention, right?
Yeah, we don't have time, unfortunately. But if you want to learn more, you should definitely contact Ranjani, and you can participate and go through these interventions as well.
Yes, I'd be happy to speak with any of you. All right, so I have to get going to work, but I'll see you later. Thank you.
Bye, thank you so much.
Bye, Misha.